Hello, and welcome to a presentation on the U.S. federal budget. I'm Dr. Donna Gurley. I'm by no means a financial analyst. Most public health professionals are not. However, it is important to understand how public health services are funded and where we can make an impact in obtaining future funding. Today, I'll go over a few basics about the federal budget. You know, most Americans don't understand how the government is financed. First, the United States budget is big, trillions of dollars big. The budget provides policy or drives policy, particularly health policy. And finally, the federal budget is administered by the Office of Management and Budget, which is located within the White House and reports to the President. Before we start, let's define some key terms. Revenues are sources of income for the budget and come mostly from taxes. Second, money spent on specific services is better known as spending. Examples of federal spending include health care, Social Security, and the military. From this chart, you can see that the majority of the federal government's budget revenue comes from personal income taxes, payroll taxes, and corporate taxes, which accounts for more than 90% of the $3 trillion in our federal budget. Yes, $3 trillion. Corporations located within the United States pay up to 35% in taxes to the federal government on their profits. States with no state taxes are considered corporate friendly because there are less taxes to pay. Over time, corporate taxes have fallen, as you can see, where individual taxes have risen, and this is based on the percentage of income by either an individual or a corporation. So how does the government spend its money? Federal spending is divided into three categories. Mandatory spending accounts for the majority of the budget's expenditures. Discretionary spending is less than 1/3 of the total spending. And finally, interest paid on the national debt, which is roughly 6%. We'll go into more detail in the last two categories, which account for more than 90% of the federal budget. The category of mandatory spending is money that is earmarked in a particular policy to fund a specific program over a defined period of time, usually in years and sometimes decades. Unless Congress changes the amount within the policy, the amount is guaranteed for the life of that policy's authorization. When the period of time expires for that specific appropriation, Congress must reauthorize the appropriations, otherwise no funding is guaranteed for the program described in the policy. Examples of mandatory health spending are the federal Medicare program, or health care for the elderly, and Medicaid, which is health care for low-income families. The type of spending here is referred to as budgeting for goods and services. For example, if Congress promises free immunizations for all children, how much would that service cost? That amount would then be appropriated by Congress. Next is discretionary spending, and that's money that represents about 30% of the total budget. How this money is spent is decided by Congress rather than mandated by a specific policy. If Congress does not appropriate money, the assumption is that no services will occur for that particular program. Specific examples of discretionary spending include the National Institutes of Health, the Centers for Disease Control and Prevention, or CDC, and Title X family planning funding. This is also known as budgeting by dollars. For example, if Congress appropriates $100 million for childhood immunizations, how many children could be immunized for that amount? Probably not every child. This chart shows the distribution of the $3.8 trillion in total U.S. federal spending for 2015. Let's look at some examples. Can you answer correctly which is mandatory and which is discretionary spending? For example, the military has 16% of the total budget. Is that discretionary or mandatory spending? It's discretionary. Social Security, the largest share, takes 33% of the budget. Is that discretionary or mandatory spending? That's mandatory. Medicare and health, the second largest share with 27%, is actually both mandatory and discretionary, although discretionary only accounts for 6% of this amount. And look at transportation with only 2%. It actually is both mandatory and discretionary spending as well. The U.S. Department of Health and Human Services, or DHHS, oversees all health-related activities at the federal level. Remember from earlier slides that this funding is mandatory funding. However, some of the funding is discretionary, and the Secretary of DHHS has proposed $82.8 billion in discretionary spending for the fiscal year 2017. Here are some examples of how that money is proposed for spending. Screening and treatment of mental health disorders, preventing prescription, heroin, and opioid drug overdose, performing Medicare and Medicaid, reforming Medicare and Medicaid with projected savings over 10 years, combating drug-resistant bacteria which infect an estimated 2 million people and cause more than 23,000 deaths each year, and providing infrastructure to reduce foodborne illness outbreaks which occur in almost 50 million people, causing 127,000 hospitalizations and over 3,000 deaths each year. Remember that these activities are really policy setting and provide funding to state agencies to implement this work. Little happens at the federal level because most public health services and functions are carried out at the county or state level for public health. When the Affordable Care Act, or ACA, was passed in 2010, a Prevention and Public Health Fund was established. For the first time, money was mandated at the federal level for prevention through policy. Here are a few examples of how the fund's dollars are distributed. The majority of the $932 million is given to CDC for a variety of funding opportunities, such as immunizations, preventing diabetes, smoking awareness, and preventing and responding to emerging infections from food and water sources. So remember how much is spent on health and Medicare? 27% of the federal budget, which is over $1 trillion. How does $932 million compare for prevention and public health? If you do the math, it's not even close to 1%. To summarize our topic on the federal budget, 3/4 of the dollars is spent on wages for Social Security and unemployment, health care, and the military. Almost 1/3 of our budget is spent on health care. Less than 1% of the federal budget is spent on prevention and public health. Finally, I'll leave you with one question. How can we change a sick healthcare model to a healthcare model of, well, health? When I say sick, I mean that more money is spent on treating illnesses rather than preventing them. As future public health professionals, how can you move the dial towards prevention and health? Changing this financial model would require a radical change in funding, right? What do you think would have to change? And for those of you from another country, many look to the U.S. for budget models. Is this the right kind of financial model for a healthy nation? I'd enjoy hearing your comments and ideas. Thanks for watching.